Welcome to the City of San Marcos COVID-19 community discussion. My name is Maria Rocha, and I'll serve as a moderator for this panel discussion. The City of San Marcos is bringing this event to the community to ensure that our residents have current factual information regarding COVID-19. So send a quick text or tag others that would benefit from this information so that they can join us now. If you have questions, please submit them as a comment on the Facebook page. We are striving to answer as many questions as possible during this live stream, and we will post responses to questions on the Facebook venue if they're not answered during our 1-hour broadcast. We have a wonderful group of panelists to provide you with information. Thank you all for your time and commitment to our community. Our panelists include Dr. Michael Carr, Medical Director of Emergency Department, Ascension Seton Hayes Hospital, Doug Wozniak, Director of Safety and Health Services for the San Marcos Consolidated ISD, Christina Casos Moreno, nurse, mom of school-age children, community advocate, Frank Arredondo, native San Marcan, community servant and leader. Would each panelist please introduce themselves? Give us about 2 minutes introduction to who you are. Dr. Carr?
Hello, I'm Dr. Michael Carr. I am the medical director here at Ascension Seton Hayes and Emergency Department. I am, as I told the panelists earlier, I'm new to the area. I just moved to Texas about 5 months ago. Before that, I was on faculty at University of Maryland School of Medicine. So this is a change for me, but I am just loving the Texas community and the Texan people. And I am here to try to help in any way I can.
Doug Wozniak?
Good afternoon, everybody. Doug Wozniak, Director of School Safety and Health Services. School safety, meaning all things security, drilling, those kind of things, which obviously has kind of taken a back seat to COVID. So basically, I've been all about COVID for the last couple of years. So basically, my job is to, help the nurses devise COVID protocols. We organize vaccine clinics. We've done a lot of our own testing. So basically, anything to do with COVID is kind of in my wheelhouse.
Christina Casos Moreno.
Hi, good afternoon. My name is Christina Casos Moreno. I am a native of San Marcos, a graduate of San Marcos High School and of Texas State University with a bachelor's in healthcare administration and nursing. I serve today as a registered nurse, a mom of school-age children, and a community advocate. I'm here today as a concerned parent and daughter of elderly parents and family members.
Frank Arredondo.
Hello, all. I'm Frank Arredondo. I'm 5 generations of Arredondos in San Marcos in Hayes County. I have 11 grandchildren. I've been involved in public service most of my life. I've served as a city councilman and mayor. I'm involved in most recently in the organizations of AMVETS, Vietnam veterans. I'm with the Centro Cultural Hispano de San Marcos, and I'm also with LULAC. I was the founder of LULAC here in San Marcos. In all, I've worked with local government, state government, and with the federal government. And I'm basically now getting retired. Thank you.
Our first question is to Dr. Carr. What is COVID-19? Can you talk about the different variants and where we stand now?
Okay, very good question. COVID-19 is a coronavirus. And so there's multiple viruses out in the world that we come in contact with a lot. And as you've probably experienced in the past with the flu is the influenza virus. It can mutate and vary, from year to year, where some years we have a very bad flu season. A lot of people get sick and some get really sick. and some flu seasons are very, very mild. So coronavirus is a kind of a virus that most often just gave people kind of a upper respiratory kind of, sniffles, sneezes kind of thing. This one mutated in a very kind of bad way. And some of those early variants you may have heard on the news, with the Alpha variant and the Delta variant, those were kind of the first types of the Corona-19 or COVID type 19 virus that came through. And those were, for most people, very mild, but there was a small percentage of people that were getting really sick, as we have unfortunately experienced. Currently, we are experiencing the Omicron variant. This is the next kind of variation. This is more like the life cycle of most viruses. Over time, most viruses mutate and self-select out to be more contagious because they keep wanting to spread, but less virulent because they don't want to keep killing off their hosts. And we're seeing that with the Omicron variant. It is becoming much more contagious. As you have probably heard, it's sweeping across the community, it's sweeping across the country. It's getting to a lot of people in communities that weren't normally getting exposed to COVID before. But the good side is we're seeing a lot fewer serious conditions. We're seeing a lot more kind of upper respiratory, cough, sniffles, sore throat, headache, but very mild. And so this has been a real blessing for us in the healthcare community that we're bracing for another wave of very sick patients. So there are still the occasional person that is getting COVID and is getting very sick. And so I just stress that if you are having serious symptoms, please come to the hospital. Let us take care of you.
Thank you. Doug, how does COVID-19 spread, and what measures has the school district taken to keep our children safe?
So to kind of break it down into simplest terms, when an infected person exhales or sneezes or coughs, they put those tiny little water droplets in the air, right? And if I happen to inhale that, or it gets in my eyes, nose, mouth, then I possibly can become infected, right? If it's on the surface and I touch that surface and then transfer it to my mouth, that's another way. So there's really, kind of three main ways. As far as our kids are concerned, we have a lot of protocols in place right now, including mask mandates. We really try to emphasize, like Dr. Carr said, to be aware of symptoms. So please, stay home if you have symptoms. We don't want you coming to school. Maintain social distancing when feasible, right? We use dividers when we can. Encouraging kids to continue to wash their hands. Excuse me. We also have done something a little bit more aggressive than a lot of districts around us, in that we are testing in-house. So we do the rapid tests. Our nurses are in charge of that. We also bring in a third-party company on Fridays to do asymptomatic testing. So we've got the symptomatic testing throughout the week, and then we also try to hit the asymptomatic population when we can on a Friday. So that's been a lot of work for the nurses, but of course, as you know, the protocols are more than worth the effort.
Mr. Arredondo, who in the community has been most significantly impacted by the pandemic, and what are their biggest barriers right now? If you would unmute Mr. Arredondo.
I apologize. As I was saying, COVID does not discriminate. It hits everyone in the community. But the people of color are the ones that are mostly affected. That's because, for the most part, they're either in the construction industry, the service industry, and they're essential workers. They don't have the ability to work from home, to isolate like other citizens. And usually they don't have health insurance. And it's hard for them, one, to get transportation, to get assistance. So basically, they're the ones that are suffering the most and the ones that really need the help. If there weren't people picking the cherries and the cabbage, if they weren't roofing houses, doing the plumbing, working in the service industry. America would not function, and they're essential, but they're the least ones that people think of and take care of. Things have to change. And I think COVID is making everyone aware of how important everyone is to our communities and to the employment sector as a whole.
Mr. Arredondo, could you
Yes.
tell us your personal experiences about that, Mr. Arredondo? You know a lot of community people, don't you?
I do, and I interact, and I cry with them, and I feel for them, and as much as I can, I try to provide direction and resources to them. You know, a lot of the people of color, and I'm talking mostly about the Hispanics, they have a language barrier, and it's difficult for them to express their needs or their wants or the problems that they're having. And it takes a lot of us that are native or English speaking to try and help them navigate the resources that are out there, and all the resources that can assist them, not only health-wise, but also to get food, to get help for paying the electricity bills. People are having a hard time unless you're out in the neighborhoods, unless you're out involved with people. You're not aware, and you can't but have empathy for people that are suffering. And usually it's when you get to these families, they're large families, you know, they're aunts, uncles, nephews, nieces, grandchildren. They're all being affected. And then when a funeral takes place, that's another factor that enters into that most people don't realize until they have to feel it. They sometimes don't have the funds to bury someone, so they've got to go to cremation is the least expensive if they can get that assistance. So, you know, all this COVID has brought to the forefront the way people are suffering and making everybody more aware. The empathy that we have to provide to these unfortunate people. I pass now, Ms. Rocha.
Thank you, sir. Christina, how can I protect myself and my family?
Yes. Well, I just wanted to touch point on Mr. Arredondo. Thank you for sharing that. You know, you mentioned empathy and how important that is for ourselves and within the community, recognizing the needs of others. You know, we talk about for ourselves, right, to prevent infection and to slow the transmission of COVID-19. What can we do? So washing our hands regularly with soap and water, covering our mouth and nose with a mask when in public settings, maintaining 6 feet distance between you and other people, avoid touching your face, covering your mouth and nose, being mindful of other people's space, staying home when you don't feel well, refraining from smoking and other activities that weaken the lungs, and practice physical distancing by avoiding unnecessary travel and staying away from large groups of people.
Thank you. May I also ask, if I wear a mask, am I protecting just myself, or am I protecting myself and other people, or am I only protecting other people?
Right. Well, wearing a mask, we're protecting everyone, so ourselves and others. And it really goes into play with what Dr. Carr and Mr. Arredondo were mentioning, just caring for others, not just ourselves. recognizing that we're in this together.
Thank you. We're in this together. Thank you. Dr. Carr, could you share with us a snapshot of what medical staff is currently experiencing? How can our community support medical staff?
Medical staff, I'll be honest, is tired. They've been doing this for almost 2 years, and it comes in waves. And so it gives you kind of that hope that, you know, maybe this is the last one. I am actually very hopeful that this last Omicron variant is going to be the last one, and it will then kind of fade into kind of the background. I think we are going to be dealing with COVID for generations to come. And as an emergency physician, years from now, when you come in sick, I will not only be testing you for the flu or influenza, I will be testing you for, you know, the seasonal COVID vaccine. But right now, the emergency departments have, you know, been waxing and waning, high volumes and then low volumes, and then dealing with a lot of very sick people. That has been very heart-wrenching for us, because these are our community. These are our family members that are coming in very sick, and as medical professionals, we do our best for them, and sometimes it's not enough. And, you know, we have to deal with that emotionally, as well as, you know, trying to continue to do our job. So we are trying to do the best we can with what we've got, and we've gotten so much better at dealing with COVID over the time, because we've learned so much more about it and how to deal with it. And so we are there for the community, and we are trying to do our absolute best for everybody.
Dr. Carr, what can we do to support you? I know I used to go to the emergency room with my husband scared to death, and now I'm a little bit less likely to do that. So how can we support you as a community?
Well, follow the instructions so we keep each other healthy. You know, get vaccinated. So if you do happen to get sick, your immune system has kind of a head start to fight it off. So vaccinated, boosted, wash your hands. If you are sick, please don't go into work and spread it to everybody. You know, take the time off to quarantine yourself and get over it. Let your body's immune system fight it off so you don't give it to your neighbors. And now, if one of your family members gets sick and you all have kind of the similar symptoms, know that you probably have COVID. You all don't need to run 20 of you into the emergency department to get tested. Just, you can use the outpatient testing centers so you can confirm that this is COVID and follow the proper instructions. But if you are sick, please, you know, if you're not feeling well, you're not feeling like you can breathe, please come in. We are there for you at all times. So we, like I said, have gotten very good at taking care of COVID patients over the last 2 years due to a lot of practice. So everybody kind of has their role to play to try to A, prevent the spread, and B, take care of yourself when you yourself may come in contact with it.
Thank you. That goes back to, we're all in this together.
Yep.
Christina, what is the risk of my child becoming sick with COVID-19?
Great. So most children with COVID-19 have mild symptoms, or they may have no symptoms at all, so being asymptomatic. Fewer children have been sick with COVID-19 compared to adults. Babies younger than 1 and children with certain underlying medical conditions may be more likely to have serious illness from COVID-19. I did want to touch base on what Dr. Carr mentioned, and just being, you know, proactive, being prepared. You can really help them manage that anxiety of COVID-19 by creating a plan in case you or someone in your household become ill. So just like a fire drill, right? It's better to be prepared than to be caught off guard. So this may look like a folder with healthcare information, creating a backup plan for child or elder care, understanding your employer's sick leave policy, having a list of supplies ready. So, you know, having those tissues, cleaning supplies, thermometers, etc., just available, which most of us do already. Considering alternative ways to reducing contact with others. So that may look like online shopping, curbside delivery, and communicating your needs with friends, families, and neighbors in a safe way, right? Drop off, those calls can really be helpful in this time.
Thank you. Dr. Carr, are COVID-19 vaccines safe for children and adults? Can your child get COVID-19 from any COVID-19 vaccine?
No, you're not going to get COVID from the vaccine, and they are safe. They've been reviewed by, CDC, FDA, multiple World Health organizations, and currently they are authorized for anybody 12 and older. And it is currently recommended that you not only get the full vaccination series, but you also get the booster. And what it's doing, the vaccine is a mRNA. It just generates your body to make a single protein that then it recognizes as foreign. And the single protein is one of the main proteins in the coronavirus. So what it does is essentially primes your body's immune system to recognize COVID when it comes in contact with it and start your own body's immune process to fight off the invader early. And that's why sometimes people, even with the vaccine, especially in this Omicron variant, can get COVID. You can get exposed to it and it can replicate very quickly. But then if you've been vaccinated, you lessen the severity, lessen the time, and you have kind of a jump start on the immunity response to it. So you are not going to get COVID from the vaccine. Those are very safe. You may get a response to the vaccine where you're going to be a little feverish, a little achy, but that is your own body's immune system kind of doing what it's supposed to be doing. It's recognizing a foreign invader and generating a response.
So if your body does not have any kind of reaction, does that mean that it's not doing what it's supposed to do?
No, it's different people react different ways. And as I said before, some people have already been exposed to coronaviruses for, other reasons, other different variations of coronavirus. And so even in closed populations of people that have been exposed to COVID, about 1/3 of the people never come down with it. And that's because I think they've been exposed to other coronaviruses and their own body's immune system is able to recognize it and fight it off. And so it is very important that you do get vaccinated because it gives your bodies that extra edge, that extra jump on fighting off the infection. And especially those people that are at risk. And that includes people that are other medical conditions, lung conditions like asthma or COPD, heart conditions, diabetes is a very, potent, cofactor, risk to these individuals. People, unfortunately, who are overweight are dealing with the worst side effects and worst outcomes to COVID and Corona. So keep healthy, take care of yourself, support your own, your own health, exercise, do all the things that, I laugh listening to my co-panelist here telling you to do all the things that we learned in kindergarten. Wash your hands, stay healthy, exercise, eat well, get some sunshine. So these are all the things that each individual can do to try to help and stay healthy.
Thank you. Christina, how has COVID-19 and the fluctuations in school procedures impacted you as a parent?
Yeah, great question. I mean, there's been so many challenges, right, as parents through the pandemic have been facing from the start of the lockdowns, social distancing, face masks, to school closures. I mean, it's impacted our household dynamic, shifted routines, work schedules. I mean, even to the amount of food and toilet paper we have in our home, right? The truth is that we as parents have become creative and resilient together. I think that the schools are continuing to do their best to align with the ever-changing recommendations. It's not always an easy balance. While it's caused issues and there's been some concerns, at the end of the day, we keep moving forward with the end goal of protecting each other and our children.
Thank you. Oh, you sound like a wise parent. Doug,
I, yeah, definitely learning together with everyone, from the very beginning, how terrifying it was to where we are today. I mean, we have just pivoted and made so many new, it's the learning process, right? As parents too. So yeah.
well, Doug, what do children ages 5 years and older need to be? Why do children ages 5 years and older need to be vaccinated?
Well, although, we haven't had as many cases nationally, there's still well over 2 million kids in that young age group that have gotten it. And so we know with this Omicron variant that kids are getting it, right, at a very rapid rate. They are being hospitalized. And so by getting that vaccination, right, like Dr. Kerr said, you're lessening the severity on the back end, and you're also protecting other people in your household, grandma and grandpa, mom and dad, anybody that might be at risk, keeping them safer and from getting that extreme reaction that they might have. So a lot of benefits to getting vaccinated, and we're going to continue to push, as a district, initiatives to try to help our kids get vaccinated. I think we've just finished our first round vaccination just from around the holidays. And I think we're getting ready to gear for a third round of clinics here.
Thank you. Mr. Arredondo, what do you feel our community can do to help decrease the spread of COVID-19?
Well, many of the things have already been mentioned. One is keep social distancing, masking, making sure that you don't go into any crowds that you really don't have to, and just really isolate until everybody can get this under control. And I think one of the things that we've seen, it's been out in the public, is that the unvaccinated persons are the ones who are really the threat to most of the country, in not being able to stop the continual spread of this virus. Somehow somebody has to come up with either an idea or something to change the minds of those people who refuse to vaccinate. We may have some in our own families, and so it's difficult. So I can understand why we're having trouble getting rid or stymieing the spread of this virus. So just all the things that the health professionals have been telling us: distancing, masking, getting your COVID shot and the boosters, getting the children, the young ones, as soon as they're eligible, get them vaccinated. That's my 2 cents.
Thank you, Mr. Arredondo. Dr. Carr, what's the latest information on boosters? And when could we expect students or children to be eligible for boosters?
I believe boosters are only recommended for ages 12 and up at the moment. That is still under review. I would have to check the latest CDC guidelines. They are recommending a booster. It is, I think, 5 months after the Moderna or 6 months after the Pfizer. I may have those reversed. I would have to look at it, but they are recommending a booster. This is kind of it's a running game of, hide and seek with viruses. And so what you're trying to do is give a vaccine to stimulate your own body's immune system to develop antibodies, as well as, immune cells called T cells that will recognize when it comes in contact with the virus. Now, so what you're doing with the vaccine is you're kind of priming your immune system to recognize the coronavirus if it shows up. Now, there is your immune system can't always be on high alert. So you get the vaccine, it's very primed, but over time it kind of wanes away. So the booster gives it that extra extra kick to remember it, to create a few new antibodies to circulate around. And so especially in this time of kind of the Omicron variant, very fast onset, sweeping the country, lots of contacts, lots of exposure. Now would be a very good time to get that booster. So you will be exposed to Omicron almost assuredly. And so this is your best way to kind of lessen the severity. Now we are seeing people that are getting the COVID, infection with vaccines. And so, that's, just because you're vaccinated, it does not mean you are immune to the infection. What we're trying to do is lessen the severity, lessen the risk of bad side effects, give your body's immune system kind of a head start to try to fight it off.
So did I understand correctly, the booster is not the same as the vaccine? It's a lessened dose, or?
It's a lessened dose. So what it essentially is it is creating a protein that the COVID virus has. And so your body is now recognizing that protein as a foreign invader, and your body will generate antibodies to attack it or killer T cells to attack it. And so the first initial vaccines are kind of a larger dose of that ability to make that protein. And then the booster is a lesser dose just to re-stimulate your immune system to say, this is what, this is a foreign invader. If you see it, go and attack and kill it. And so the first set of vaccines are much higher dose. The booster is a lesser dose. So there's also a lessening of any kind of side effects after getting the booster shot, of just the, maybe fatigue, maybe some soreness, maybe a little low-grade fever. Those are all kind of standard post-vaccine, post-booster symptoms, very mild, usually last less than a day, and then go away, usually with just fluids, time, a little Tylenol. And so these are just kind of giving your body's immune system a look at the COVID virus protein so it can recognize it if it sees it again.
Thank you. It's important to understand vaccines and boosters and exactly what they're doing within our system. Thank you. Frank Arredondo, what have you seen our community do well in its response to COVID-19, and what could we do better? Are you thinking or are you muted? I think you're still muted, sorry. Thank you.
Okay. One of the things that has come up is that a lot of volunteers have shown up to help in testing sites and to help navigate the injection sites. I think that it's brought this, we're in it all together, has been mentioned, in trying to help as much as we can, even though it's not our sphere of being educated in, but there's people out there working hard in trying to bring resources, getting water out to people, getting food out to people. I think it's becoming a real community in the sense that those who have empathy, who want to do good, to help along with what the problem is right now. I don't have anything else to add right now. I can't think. Thank you.
Thank you. So Doug Wozniak, what measures have our schools taken to keep children safe? How has this impacted our teachers? Has COVID had a direct impact on student or staff mental health? Lots of questions.
Sure. As I mentioned earlier, we've tried to take the most aggressive approach that we possibly can. Our board has enacted a mask mandate. We've done hundreds, if not thousands, of in-house testing with rapid tests to try to identify, kids that are sick and get them home, quicker than if, you had to call a parent and say, hey, I need to come pick up your kid. And then, we've got hours that might go by before we can get them the information that they need. Again, dividers in rooms and cafeterias has been a big one. Lots of hand sanitizer. I think we bought barrels and barrels that we have sitting in warehouses to constantly replenish. As far as, and then again, the big one for us, I think lately has been vaccines, right? The big push of even going back a year or two when we began aggressively vaccinating adults. We had our own nurses in SMCISD vaccinate over 1,000 people, just themselves in-house. So we've continued to try to be on the forefront of getting our own people. We're close to 83% of our own teachers and staff members being vaccinated, which again, directly affects the kids as far as the safety in the classroom. And now we're trying to, take that same approach with our kids and to get the word out and to offer those clinics. As far as teachers are concerned, kind of like Dr. Carr said, they're tired, they're exhausted. It's been a long couple of years for them. Anytime you have kids out, whether it be in a remote or conferencing situation or a classroom shut down or just, multiple kids out, it's always more work for that teacher with planning. And so it seems like for the last couple of years, teachers have had to do twice the amount of work that they used to as far as planning and prepping and getting things ready for kids. Just the worry and the stress for teachers, wondering what's coming next, wondering what the next variant is going to do. How many of their kids, in their rooms are vaccinated, how safe their classroom really is, and are they taking it home to, anybody that might be at risk in their own household. We have to remember teachers have their own lives and they do have families, and they take all that stress and that stuff home with them. As far as the mental health, I think there's no doubt that anybody would disagree that it's taken its toll on our students. We know nationally, right, suicide rates are up. Our counselors have been as busy as they've ever been with addressing kids. Anytime you have kids that are isolated for long periods of time, it has a direct result and negative effect on their socialization. And when they come back, especially the really young kids, you have to realize when a pre-K kid misses multiple months of school, those key moments when they're young and they're learning how to socialize, you see that in kindergarten as those kids get older. You see that those developmental delays sometimes. And so there's no doubt that it's been a challenge for the mental health of everyone. And that's why, currently anything we can do to keep our kids in school, right? We feel like having them be there in person in a safe environment, safe as we can be, is really the most beneficial thing for that kid.
When you do have cases of mental health issues or stress issues, what services do you provide to support that?
So we not only have counselors that are, traditional counselors in the way you might think, where they make schedules and all that kind of thing, but we have other counselors that deal with nothing but the mental health type of situations. And so we have those, spaced out among the district specifically for those kind of needs. So we've kind of almost divided counseling into two different worlds, right? The old school of I make your schedule, I help you with those kind of things in college readiness. But then we have the other piece of it, which is the mental health counselors that help our kids.
Do you have special intervention for the teachers that are thinking of leaving the school system because they don't feel safe?
I would say that, again, that falls under the area of some of the things that we've tried to initiate as a district with health and wellness, just from an employee level, just trying to be more aware the last couple of years of self-help, of things like yoga, of things like offering classes for teachers, right? That might alleviate some of the stress. If you remember, right before Christmas, the superintendent gave us a mental health day to add on to the vacation. And just thinking about those kind of things as we move forward with trying to, to get our adults the same kind of help that we're giving our kids.
Thank you so much. This is a lot of work. Thank you for all that work. Christina, since you have a background in mental health and wellness, can you share some steps that we can take to stay mentally healthy?
Yes. So, I mean, as a pandemic continues on, it's so easy to feel worn down. We all feel that way, right? So taking care of our mental well-being, especially our children, it's become more critical than ever. And so just encouraging sticking to a schedule, exercising, eating healthy, going outside to get some sunshine or fresh air each day. That can look like taking a walk around your neighborhood, or my favorite, exploring our beautiful trails in San Marcos. Gratitude. The more we look for the positive, the more we're going to find. That can look like gratitude journals for our children, taking some time out to talk to them about what's been going good for them. Really taking their perspective on their days, listening in, and just bonding with them, and helping others. I know we talked about what can we do for the doctors? What can we do for our teachers? So this may look unique and different, but the more we help each other, the better we feel. And laughing and smiling. So, that can look like watching a favorite movie, a comedy show, something fun and uplifting, and connecting, right? And taking that time for yourself. So if you live alone or you're starting to feel disconnected, making that call, just hearing a voice can just be so impactful, and to stay connected with others. And for the opposite, right? I mean, if we're surrounded by family all the time, stepping outside alone to just give yourself some quiet time. I know that it's just even, going outside to get your mail, or just sitting down outside. So, and also I did want to take mention of, if you're working, checking in to see if your employer offers the Employee Assistance Program, EAP benefits, or counseling. A lot of health insurances have mental health programs that you can take part of. So it's just making that call, seeing if they have programs for yourselves and your children. And remembering that taking care of yourself really allows you to care for others.
Very inspiring. Well, panelists, we have a few minutes left, and I would like to ask you each to think of some wrap-up remarks you would like to provide to the audience. Any last pieces of advice, or perhaps some issues we did not cover that you think are important, or encouragement, as Christina just gave us. If you would please provide that to our audience. Could we start with you, Dr. Carr?
Okay, I think the take-home points I think everybody's been emphasizing is everybody please get vaccinated, and especially if you have comorbid conditions or are higher risk or older, please get booster shot. We all need to look out for each other, especially those people at the highest risk. Like our other co-panelists said, please check in on elderly neighbors or communities of color that may not have access to healthcare, and if they are having problems, we are here for you. So the Ascension system has put out, outpatient testing centers. So if you are concerned that you have COVID, there are numbers you can call to, get an appointment to get tested. If you have kind of mild symptoms, mild fever, mild upper respiratory type stuff, most likely it's COVID. And, you don't need to rush into the emergency department if you're feeling, just a little cold or flu symptoms. Take the common precautions, isolate yourself, hand washing, support yourself. But if you're having symptoms, please, where you're trouble breathing or you're just not feeling well, please come in. We are there for you. We want to take care of you, because in this disease we have learned, if you get in early, we have treatments and we have the ability to care for you much better. If you wait long time and you get worse, we're behind the curve, and it's very difficult and very, very frustrating for healthcare providers going, please, come in early when we can make a difference. So there are treatments available, but they are most effective early on in the course if you are not feeling well.
Thank you so much for those words. Mr. Wozniak?
Yes, ma'am. I think it's safe to say there's a lot of fear right now. Our numbers have really skyrocketed compared to where they were, before the holiday break. So, our hope is that parents continue to talk to their kids about what to expect at school, to make sure that we, something as simple as just making sure we have our facts straight about what you've heard on this call today, with what's involved with COVID, making sure that what the resources are. We have the ability to test kids. We have the ability to vaccine students. So our hope is that, our parents continue to be aware of that, to, talk to your kids constantly about mental health and the kind of issues like Christina was mentioning earlier, so that they're aware and so that they're educated, and that makes that transition a little bit easier. If they are out and they do come back to school, we want to make sure that they don't miss a beat, and that we're taking care of these fears, because it is a big deal right now with the way our numbers are going. And again, we know there's just such a fine line between providing that safe environment physically, as far as safety, and then keeping an eye on the mental health of everybody. So we have to walk that line constantly as a school district to decide when is it best to possibly shut classrooms down, and when is it more beneficial for those kids to be in class because of their mental health issues. So just take all of that into consideration, as we navigate this.
Thank you so much. Mr. Arredondo?
First of all, gratitude. I think that we all owe a lot of gratitude to the health professionals, the nurses, the doctors, the support staff in the hospitals, for the time and the strain that they're under to take care of us. The other group is the educational system, the teachers and the staff, the support staff. I'm sure they're all working extra hard, putting in more hours than they normally have to try to make the environment safe for our children, as well as the health workers. And also gratitude to all the volunteers who out in the community are helping in one form or another, or in any fashion, in helping in the testing sites, and getting food to homebound seniors that have nowhere else to get nourishment. And I think just that gratitude of in itself helps uplift the whole community. And we all can complain, we all can mesmerize about the things that are going bad, how people are feeling, but we also have to have hope in our heart and gratitude. And I thank you for allowing me to say a few words. I'm not a professional, I'm a lay person. So I go mostly from emotion and empathy in trying to get whatever good I can give. I thank you for allowing me to participate.
Your elder knowledge is very much appreciated. Thank you.
Thank you.
So Ms. Casas Moreno?
Yes. Well, thank you, Mr. Redondo. Those were such wonderful points. So just going back to mental health and well-being, parents, I just want to say that you guys are doing an amazing job and taking credit for the small things that you are doing, the big things that you're doing, communicating with your children, This is such a wonderful time to start to explore different things together as families, learning about arts and cultural, learning about the different programs that are within your cities. If it's picking up a dance class through Zoom or learning stress techniques. These are all things that we can do as families together at home that really we can see the benefits of that even going into school. Those coping techniques, being able to just learn stress management. We can definitely link some of the helpful websites that I think would be very beneficial for our families. But yeah, I just wanted to let our parents know, let our community know that there are so many resources and that you're not alone.
Thank you. Thank you so much to all our panelists for bringing your expertise and wisdom to this important discussion. We appreciate Ascension Seton and San Marcos Consolidated ISD for supporting this effort. And thank you to everyone listening in. We hope this has been beneficial to you. The City of San Marcos will make this video and list of frequently asked questions available on their website for future reference, and so that our residents who were unable to join us today can watch it at their convenience. The frequently asked questions will also be available in Spanish. So be safe, wear your masks, wash your hands, and continue to social distance as necessary. Have a wonderful weekend.